You're doing very, very good here. There's actually some fat dripping out already, and that's what you're feeling warm go down you. Okay, my friend, we're actually going to take out the fat now. This is the easy part. And what I'm going to start with is what's called a microcannula. These have come a long way from the images of liposuction people have had years ago with like the big jabbing. This is actually going to be all in the wrist. There are several different types of instruments of different lengths, of different sizes, different amounts of holes, but this is about the average size, and we should be able to accomplish most of what we need with something as teeny as this. You will feel my motion, but if you feel anything out of the ordinary or painful, please let me know. I can adjust your position. This is actually the advantage of having an awake patient. You're part of the process here. Okay? My patient here is actually quite awake, which is, as long as he's comfortable, I'm comfortable. There are times where I'm actually going to sit him up. Now, you are quite small. Certainly can do patients much bigger as well. But sometimes it's people that are in almost perfect condition that really take the most sculpting. Okay, my friend, tight as a drum. Looks great. You have no bruising, and it's nice and flat. Now, I'm going to turn you over. We're going to start working on the sides, okay? Very good. At any moment you feel any jabbing or anything that you can't tolerate, by all means let me know. Seems like you're doing fine. Sometimes the back is a little tight. Sorry. Next time I'll try and induce pain. I'm sorry that I'm tickling you. It's coming out beautifully. You can see it going down already. We're just gently massaging out the fat. You don't have a single bruise on you. Looking very good. These holes are going to close up beautifully. You can see the shape of the love handle conforming already. This is what sculpting is. What I want you to do, let's take this away. I want you to grab my arm, and I want you to gently slide down. You're going to come over here. Try not to move. Unless you feel discomfort, you'll let me know. Could you shut off suction, please? All right, it's about as good as it gets. Let's take a look at you from behind. All the way, turn all the way around. All right, well, you're coming in now. That's fine. Very good. Okay, my friend, you're finished. Let's shut off suction. Take a seat. Okay. So how you feeling?
Great.
Good. We did amazing. I expect you to be a little bit groggy now. You have this tight garment on. This is going to stay on with the bandages for about 36 hours. Tomorrow night you'll take it off, and we have everything written out for you in terms of post-op instructions. We're going to give you a few days of antibiotics. You should not need anything else other than extra-strength Tylenol. I want you to continue staying away from things like Advil and any other pain medicine. Truthfully, I left a little local anesthesia in there, so you should feel fine tomorrow. We gave you all the antibiotics you need. We give you all the checklists of information you need for post-op material, and I'm going to see you in about 4 or 5 days.
Great.
So you should be in no pain right now, and we got about 2/3 of a liter of fat. If you could picture a liter of Coca-Cola, we got about 2/3 of that. So that's going to totally change your body shape.
Thank you very much.
All right, my friend?
Thank you.
Okay, I'll see you in about 4 or 5 days, all right?
Okay.
Good. How'd you do?
Great.
Okay. Any pain?
None.
Were you able to get back to your activities pretty quickly?
Yep.
Okay, let me have you stand up. Let's take a look here. You've been wearing this garment pretty much 24/7 since the procedure 4 or 5 days ago.
Yep.
All right, exactly what we should see. Puffiness, which is normal. The fat is gone. You have no bruising. Your little holes are closing up. Some areas you see the end result quicker than others. And right now you should be seeing about 40%. You should have some mild tenderness. I'm actually surprised you really have no bruising whatsoever.
I had none.
You'll be able to get back to your activities as tolerated, so you can go back to the gym, go back to vitamins, pain relievers, anything that you normally did before you could certainly do now. I think in a week or two you'll see about 80% of your end result, and then for every week after that it'll only get better up until a few months.
Great.
Okay? All right, let's get this back on and get you out of here.
Thank you.
All right.